and today we're gonna go over good old-fashioned, you know what, labral tears. We're gonna go over the surgical techniques that are done to resolve your snapping hip syndrome coming from that labral tear. Let's go ahead and start the show. Folks, what we're looking at here right now is a very healthy ball and socket, or also known as the acetabulum and the head of the femur. And so realistically, you see all those ligaments around that nice little picture? They're kind of helping to increase the size and depth of that socket, as well as give this ball and this neck of this ball something to anchor on, kind of like a nice little neck in clamp. And so the reality is when you have something like that where it's nice and healthy, you can see, boy, I want to keep that thing nice and protected. But unfortunately, when it comes to snapping hip syndrome, that doesn't happen over time. Over time, we get degeneration, like what I'm going to show you right here. See that right there? That's classically where everything is kind of worn a little bit. You see that initial picture right here, where it's nice and shiny, and now side by side showing you those two, you can see where when it's nice and shiny, and then when it kind of starts to wear over time, and how it's very easy to get things inflamed, and unfortunately go from inflammation to a tear. Now we're gonna go ahead and look at some different videos on the different surgical techniques, namely something that's frayed, something that's torn, and something that needs to be repaired. And so let's go ahead, we're gonna look at this first one. All right, let's go ahead and see that little tentacles there? That's a frayed socket labral area. And we're gonna go ahead and take this little rotor rooter and we're gonna go ahead and clean that area up. Clean that area away as best as possible. Obviously not being as good as it used to be. The reality is it's not as good as it was when you came out of your mama's womb. And so our next one, is you see that little probe poking in on there? That's a torn labrum. And so in a younger population, we can go ahead and sew that back together. This nice little cool technique where they go in, they pull down through that labrum, kind of lasso a hook around it and pull it right on back through and tie it back together. Now, they also, in between there, they have to go ahead and shave in between that little two areas that is torn. That way it gets some blood going on in there, and that way when you get blood in there, it can go ahead and heal itself back together once you get those two pieces meeting. And that's that second technique. Now, the last technique that we're going to talk about here is that next technique when something is frayed but it's not too bad, it's not really torn, and it's in an area right along that rim, right along that top part of that rim there. You don't want to get that rotor rooter in there, you'll probably destroy too much of it. So they'll use this cool little probe that I'm showing right here on this little thing, and look at that, it just kind of glides across that. Now that has electricity and heat in it, and so what that does is kind of melts that torn tissue away. And so that's another cool techniques that the surgeon can do to help get you away from pain and resolve that snapping hip syndrome. Scully and I want you to go ahead and hit this next video right up there. Till next time, Scully and I want you to go ahead and look up and keep smiling. See you next time, folks.